until there is a cure, they are ensuring persons unite around giving the care. And with special focus on the care and management of this chronic illness, diabetes, particularly in children and youth, the possibility of complications is being avoided, thus enabling a more fulfilling life. The Ministry of Health and the Jamaica Diabetes Association are leading the charge to get persons with diabetes to take control of their health. In recent times, there have been significant strides towards improving treatment and the well-being of children and youths living with diabetes. Thanks to the help of the Muddy Youth program, this effort has reached another milestone. The 2-year Muddy Youth project came about in 2011 through the collaboration of the Diabetes Association and the Ministry of Health. With funding from the World Diabetes Foundation, the initiative is being implemented in Jamaica, Belize, and St. Lucia to achieve certain key objectives.
The first was to develop a registry of children and youth living with diabetes, increasing access to HbA1c testing to improve their glucose monitoring, development and implementation of a pocket guide for the management of diabetes in children and youth for use by the healthcare providers, and the creation of support groups and youth camps in areas where none existed.
The registry provides demographic information, and the results of medical examination and lab tests are collected. A diabetes passport was also developed for children with the illness, providing useful information on each, which should prove useful in cases of emergency. It also provides useful tips for the children to manage the disease. To improve healthcare delivery, over 100 health professionals have been trained to treat children with diabetes under the Muddy Youth program, while the National Health Fund financed the training of 5 nurses from the regional health authorities as pediatric diabetes educators.
As the child matures, then the requirements for medications may need to change. And so the provider has to be able to adjust treatment according to the stage that the child is at.
Muddy Youth is also increasing access to HbA1c testing, which tells the healthcare provider the average blood sugar level over a 3-month period and identifies persons who are at risk of developing complications due to high blood sugar levels. It's part of the measures outlined in the Pocket Guide for Health Professionals.
These guides were reviewed by healthcare professionals in each of the regions and have also been approved by the Ministry of Health.
Most children who have diabetes suffer from type 1, the form that needs to be treated with insulin. This requires frequent monitoring of blood glucose levels and, yes, making healthy meal choices and staying active to prevent complications.
What you eat will affect what your blood sugars are like. Whether you take your medications or not will affect what your blood sugar is like. How active you are in terms of your play, other things like that will affect your blood sugar as you grow, or you may be undergoing different illnesses that will also affect your blood sugar.
Shanna K. Cunningham, one of 800 Jamaican youths to be first listed on the DAJ registry, believes that while it is challenging for children with diabetes, knowing what to do and having support can help them lead normal lives.
I'm saying I'm young, I want to enjoy my life, so I'm going to break the rules and I'm not going to take any medication. I'm going to eat this, I'm going to eat that. But on the next note, I'm saying, well, diabetes could lead to blindness, kidney problems, all sorts of problems, and I'm saying, okay then, it's my life and I need to take control.
Assistance to youths with diabetes is provided via social activities, and the annual Camp Yellowbird, organized by the Diabetes Association, is one that got the support of the Muddy Youth program. In addition to learning to care for themselves, the children are able to engage in activities such as sports and educational games. The Diabetes Association is also setting up community support groups to complement the clinical management of the disease.
With the help of new partners, it is hoped that more young persons will be able to participate and benefit from the program in an effort to allow them to, as we say in the Muddy Youth Project, to control their diabetes and not let their diabetes control them.
Support can never be too much, and National Health Fund is upfront in the line of assistance. 284 of its 119,000 enrolled diabetics are children up to 8 years old. Other children could benefit as the fund steps up its school screening program. The fund encourages the enrollment of children with diabetes under the NHF program, which gives them access to medication and diabetic supplies at a reduced cost.
And that includes the glucometer, insulin, syringes, and tablets.
We need to continue with these programs that we have developed and all the support groups. We have enough talent and enough committed people here in Jamaica to let it work.
To learn more, contact the Diabetic Association of Jamaica or the Ministry of Health. Diabetic Association of Jamaica, 1 Downer Avenue, Kingston 5. Telephone number 927-9960 or visit diabetesjamaica.com. Ministry of Health, 2-4 King Street, Kingston 10. Telephone 967-1100 or visit moh.gov.jm.